You're watching Stimulating Minds on ABC 27, presented by Penn State Milton S. Hershey Medical Center.
Doctor, could deep brain stimulation be used to treat other diseases in the future?
Well, that's certainly something that we're studying all the time, and that's really the exciting part of this, is that we're using a tool that adds, doesn't subtract, and it allows us to see what we can do. And things that have been studied that look very promising are things like epilepsy, seizures, depression. Looks like it is probably going to respond well to stimulation and be approved soon. And then there's a whole range of things that have been studied and looked at, many of which look promising. Things as difficult to treat as head injury, Tourette's disease, eating disorders, and obesity have been stimulated. So there's just a huge range of potential out there, and that's the nice thing about a non-invasive and sort of additive technique like this, is that we're not taking anything away, and so it opens up the doors in ways that we've never had before.
Now, how has this technique changed the way doctors treat neurological disorders?
Well, I think that's it, is that now, in the past we were trying to prevent people from getting worse. This changes our mindset entirely. We're looking for ways to make people's lives better, more meaningful. And I think some of the stories we've seen really illustrates that so well. And that's exciting when we think that we can apply that to other difficult to treat diseases that haven't responded to other things we've done.
Thank you, Doctor. Let's check in with Deborah Pinkerton. She is in our call center. Deborah.
Hi, Val. We do have another viewer question. Dr. Wong is going to answer this for us. About 6 years ago, I started having seizures where I would blank out from 5 to 25 minutes at a time. Also, my left leg shakes and I can't stop it. Neurological tests showed nothing. Is this an early sign of a serious problem?
This is a tough question. Without knowing more history and the test was right, it's impossible to answer what this means. However, it's possible that the tremor and seizure may not be related, have been worked up and treated differently. And I think this is something a neurologist should be able to help him or her sort it out.
Okay, Dr. Wong, thank you. And we want to thank all the specialists here. You can see they're busy answering your telephone calls. Now, someone did not answer your question this evening. Someone from the hospital will get back in touch with you. We'll send it back to you in the studio, Val.
All right, thank you, Deborah. And Doctor, one final question. Agreeing to this type of surgery is probably a tough decision to make for someone. What can you tell them?
Of course it is, and none of us turn to surgery as the first solution to any of our problems. I think the people who get to this point have to sort of answer the question for themselves. Does this make sense? And the guidance that I usually give them is that the risk of doing something ought to be less than the risk of doing nothing. We've talked a little bit tonight about what is entailed with doing something, but I can't tell them what the risk of doing nothing is. And a lot of these people have a lot of trouble.
How many people have tremors? I think this may be surprising to our audience.
Well, really, we all have tremors. We all have them to a small extent, and when we drink caffeine and other things, that can bring them out more. But not that many people have it to the point where it's a disease. So it's a slow onset for those people. It usually worsens over the course of their lifetime. But fortunately, that's not most of us.
Thank you, Doctor, for your time. Now, if you would like to make an appointment at the Neuroscience Institute, call 531-4191. Go to the website listed on the screen. And we want to thank you for watching tonight. As you look at our call center, still taking some calls at this hour, we want to wish you very good health.